call the December meeting of the Spokane Regional Health District Board of Health to order. The time is now 12:35. At this time, we do not have a quorum. We will see if we can generate one additional member for a quorum, but let us begin with a roll call. Mr. Hafner.
Chuck Hafner, appointed citizen.
Susan Boyson, appointed citizen.
Pam Haley, City of Spokane Valley.
Torney Smith, Spokane Regional Health District.
Bob Lutz, appointed citizen.
Kevin Freeman, City of Millwood.
Michelle Fossum, legal counsel.
And Fitznoble, recording secretary.
Thank you. Next item on our agenda is citizen input. I do not believe we have anybody on the sheet at this time for citizen input. You will note, however, on your table there is a packet from Rose Marie Waldron for your review and consideration. Next is the chair report. I have a couple of items today to go over real quickly. First is a meeting that has been presented for a workshop, or an idea that's been presented for a workshop in February for the emergency communication and Everbridge sign-up. And over the past year and a half, the Spokane Regional Health District has played a more prominent role in the various types of incidents, including windstorms, wildfires, chemical spills, and, as always, communicable disease outbreaks. We have new board members, as well as some new elected officials on our board, and we'd like to take the opportunity as part of this proposed meeting workshop to discuss public health and Board of Health roles and authorities, activation and the notification process and how the district will keep us informed, public health's role in any community response, and scenario-based issues that may be brought before the board so that board members will have a better understanding as how to be able to make informed decisions or advise the board. So at this time, what we'd like to do is we'd like to ask board members if they would like to be added to the urgent notification system, which is known as Washington Secures. This would allow the district to send urgent messages in a more efficient, timely, and timely manner. The process for adding those folks is registering us as board members with that system. So we would need to provide their full name, work email, title, work address, and primary employer to register members as a contact. You will then receive an email from Washington Secures asking them to register for the user portal. You must complete the link you must follow the link to complete the profile, and then you can review at that time the information they put in and add additional contact methods as well as the order of preference. So if you choose to do that, we would actually urge all of the board members to participate in this, but that information, I understand, Anne, is that correct, does exist already? And
Information does exist, we just need to sign to it.
so that would be signing up through you or through Anne. So Anne will pull you after the meeting and make sure that you have that permission, grant that permission to get you in the system. So also with respect to that emergency communication, what we'd like to do is we're looking at in February on the 23rd, prior to the regular board meeting, having at 11 a.m. having an hour and a half session where we can discuss and present to the board kind of our emergency communication protocols, things like that, how that system works. Am I missing anything, Torney, on that? So Anne will be sending out an invite to all the board members for that meeting, and we would urge your attendance at that time. Make a little extra time on that Thursday to attend that meeting prior to our regular board meeting. Next up is just as part of that emergency contacts, we all in our packets today have our new emergency contacts updated as of November 2016. Keep these handy in case you have any questions or need any other information, etc. That ends my chair report for today. I'd like for the record to note that Brian Beggs has joined us, and at this time, we do now have a quorum present for the Board of Health. Next on our agenda is the Health Officer report. Torney, please.
We'll begin with Mark Springer from Epidemiology giving you an update, and then I'll have a couple items after that.
We had a couple of issues that came up since the last meeting in terms of communicable disease issues. We had an outbreak of norovirus at the House of Charity that the Health District participated in the response with. That started prior to Thanksgiving week, and at this point, that outbreak is resolved. We are almost at the end of our mumps outbreak for Whitworth University on December 5th. If we can go without any new cases, they will be out of outbreak status and 2 incubation periods without any new cases. The only other thing to maybe comment on a few items in the news, Spokane is participating with Department of Health and CDC in an investigation of a case of acute flaccid myelitis in a Spokane resident. That investigation is ongoing, and it's been a little bit in the media over the last week. Initially, when it was identified by the Department of Health as a case under investigation, and then this week that case was confirmed by CDC. We have seen a little bit of flu activity, but we are still in our typical flu season where activity during November and December is fairly mild. Any questions from the board on issues that I talked about or other ones?
Any questions?
Okay.
Thank you.
Thank you.
Thank you, Mark. Well, good afternoon. Wanted to just update you on a few things. First of all, one of the things that we're keenly looking at as we go forward is what will be the impacts on budget, both from a state and a federal perspective. The governor's budget is scheduled to be released this December 20th. As you know, that starts the process that then the legislature will work on, and you will hear a lot about that as we go forth from Linda throughout the legislative session. From a federal perspective, we're looking very carefully at what the implications will be, largely from dollars that would pass through Health and Human Services. Those either impact us directly or through the Centers for Disease Control. And it's very difficult at this point in time to forecast what will happen. One of the concerns is the risk to the Prevention and Public Health Fund as dollars are being shifted to look at research for other issues like cancers. So at this moment, some of the efforts that are being projected is that you would take dollars from that prevention fund to move into research, and that would have a dramatic impact on public health systems across the country. Yet to be seen how that really plays out. Another issue that we talked about at the last board meeting was the issue about the contract being awarded to Spokane Regional Health District and not to the Spokane AIDS Network for the case management services going forward. And John Weisman, our Secretary of Health, Dr. Weisman, was here on November 16th and held about close to a 2-hour session with individuals who were clients from SAN, with many of their case managers, with our staff, roughly 45 or 50 people in the room. Great outpouring of information. I think that Dr. Weisman listened carefully, talked about why this transition was being made, and assured that there would be strong collaboration between ourselves and SAN as we go forward. One of the things that was put forth by many of their clients was the concern that they would lose case managers that they had had for many years. We just today have authorized the hiring of 7 new people. 4 will be case managers. 1 is an HIV community worker. One is a case management program manager, and another is a coordinator for pre-exposure prophylaxis. We have encouraged those individuals who have been working at SAN to apply for those positions. And we are hopeful that we will not only see the clients coming here, but we will see their case managers as well. Lisa St. John, who runs that program, has been in regular contact with SAN and is working across the systems to assure as smooth a transition as we can. And that transition will take the first 3 to 4 months of the year, where it was originally going to start January 1. That will now roll in over the first 3 to 4 months, depending on how smoothly that goes. The other piece of information I wanted to share is that the Health Officer Selection Committee met on the 28th, earlier this week, and have confirmed that the position description for the health officer is appropriate and in place. We are looking at some outline of process that we dialogued during that meeting in terms of the procedures that we'll have to go through in the processes to advertise, do a screening and selection of candidates, and then look at interviews for the position. I have taken the process outline back to our executive leadership team, where we've had dialogue about how to refine what came out of that initial meeting. And we are in the process of finalizing that now, and we'll take it back to the Health Officer Selection Committee after we have this information pulled together. One of the things that we talked about in the committee was the effort to try and expedite this with a hope of perhaps having a health officer on as early as the end of February. In working with the exec leadership team, we recognize because of the holidays and vacation times, it's just not going to be possible, and had been also told by Human Resources that this is not the most optimum time over the holidays that you're trying to advertise or reach out. So we will be going through professional associations as well as through the newspapers in the greater Northwest region, to include Montana, Idaho, Washington, and Oregon for the advertising. And so, Susan, I think you were the only other would you like to add anything from that meeting, from your perspective?
No, I think you've captured it well. And as Tony said, we've confirmed the position description, and we're ready to move. So.
Great. Well, thank you. And we will keep you posted as we go through the process. So those are the only items I had. Any questions for me?
Questions for Tony at this time? Seeing none. Thank you.
Thank you. Oh, I'm sorry.
Oh.
The little ornament thing that's on your desk, that's just a sign of appreciation from us as an agency for the dedication that you make to support us as a board member. So thank you.
Thank you, Tony. So next on the agenda, first let me note that Spokane Valley Council member Munch has arrived, so we now have 7. Next is our consideration of the consent agenda. The consent agenda consists of the meeting minutes from the October 27th meeting and vouchers for October 2016. Do I have a motion on the consent agenda at this time?
I'll make a motion that we accept the meeting minutes of October 27, 2016, and the vouchers from October 1st to 31st, 2016.
Is there a second?
Second.
Moved and seconded. Any discussion of the consent agenda today? Seeing none, all in favor?
Aye.
Any opposed? None opposed. Thank you. So next is the beginning of our reports, which is an overview of foundational public health services presented by Linda Graham.
Good afternoon. Okay, so I just wanted to give a quick report on the foundational public health services. These are a pretty important item that is on your proposed legislative agenda, and this is also part of the major work of public health and as well as of a lot of our partners this next legislative session. The origins of this work actually go back more than a decade, and there are numerous reports and studies that have been done that I can put you in touch with if you're curious. I really just wanted to touch on the highlights and kind of get you up to speed of where we're at now in this whole process and what we're going to be asking the legislature for. So in a nutshell, this was all about an effort to really define a core set of public health services and capabilities that every community in the state of Washington should be able to provide, and that the state should be funding. It was also an effort to identify a sustainable source of funding for that work. And really, the work grew out of concerns for eroding public health funding over the years, increasing population, increasing public health threats, and really the need to increase services throughout the state. Also, for a variety of reasons, public health services really vary amongst different locations in the state. So it was part of an effort to really wanting to address those differences and see what we can do to guarantee a level playing field for a certain amount of services. All of this ultimately led to the recognition that we need to develop a long-term funding strategy for the public health system as a whole. And this includes funding for statewide efforts by the Department of Health and then funding at the local health jurisdiction level. And this eventually all became known as the Foundational Public Health Services. So the work group was comprised of people from Department of Health, the Governor's Office, elected officials at all levels. Todd Mielke was instrumental in the work. Representatives from local health jurisdictions, including some of our staff here, tribal public health, and then key health organizations from throughout the state. And the goals were pretty simple, or at least they sounded simple. Were to define a set of foundational public health services that should be provided everywhere in the state and paid for by the state. And it was interesting, before they could even get to that level, they really had to figure out, okay, what do we mean by, public health services and core services? What is that? When you really, as I mentioned before, services varied throughout the state. So, and Torney's famous for saying when you've seen one local health jurisdiction, you've seen one local health jurisdiction. So when you got all these folks together, it was really trying to figure out, okay, so what are we talking about? And that took a substantial effort and quite a bit of time just trying to get to that point. Then they wanted to estimate the cost of providing those full level of services and then identify the gap in funding. And as I said, then identify and secure a sustainable funding source. So through years of work, this is what we've come up with. So mixed in with these discussions of really trying to define the basic services, it was really looking at, okay, what really should be in every single community, and then what things, and funded by the state, but what things might a local health jurisdiction want to provide that don't necessarily, they're not priorities in other communities, or there isn't the funding capacity in other communities for those. So this is what they broke out. We have the core programs, that is the central area of the circle here, and these are the basic set of programs that need to be in every community. Then we have the dark blue ring around that, and these are capabilities, that every local health jurisdiction and the state of Department of Health need to have in order to support those core functions. For example, when we have communicable disease control, we also need to have assessment, which is surveillance and epidemiology work. Then the kind of gray fuzzy area around that are things that local health jurisdictions might want to take on themselves in order to meet local needs and local priorities, and that would then help support the overall mission of public health. I do want to mention that this really speaks to public health as system as a whole in the state of Washington. So this is things that not only the state needs to do, but local health jurisdictions need to do, and together that fits together into the whole system. Some examples of the differences between what is considered foundation and what might be a local health need. Providing tuberculosis treatment and monitoring. This is actually a foundational service. It's actually written in the laws that we need to be providing that. Providing WIC services, this is not considered a foundational service, but for example, we and other local health jurisdictions have decided that this is something that's important in our communities. We are capable of taking this on. We have the capacity, we have the income to take it on and deliver the services efficiently and effectively. Then there are places where it's both a foundational piece, but there also might be a local need. For example, immunizations, a lot of what we do is promote the need for immunizations to prevent disease spreading. But in some cases, if there's not a lot of access in a community for actually giving of the immunization shots, then a local health jurisdiction may provide that. Is that making sense? Okay. So once we defined those services, they really looked at what are the cost of all those, subtract out the current state funding, and found that we have about a $100 million shortfall in funding for those core services. And just to help you understand kind of where we're at as a state relative to some of our neighbors, Washington at this point is about $30 per capita average across the state. And in Idaho, they're about $54, and then close to $90 per capita in Wyoming. So what we are seeking from the legislature, it's what we're calling basically a down payment. Knowing that a $100 million ask right off the bat was a little bit unrealistic, particularly right now, we're looking to really fund some really near-term issues. My apologies, that should be 2018 and 19 biennial budget. So what we're looking for is for each of the years of the biennial budget, $25 million, which will go to local health jurisdictions to really focus on communicable disease, chronic disease prevention. And these were determined to be the most critical near-term needs. That's why they rose to the top for this ask this year. And they were also among the most underfunded services from the state. There's also $3 million a year to Department of Health to improve their capacity for disease monitoring and expand their laboratory. And then $2 million a year for some pilot programs, really wanting to explore the potential of local health jurisdictions sharing some services and seeing where we could find some efficiencies and economies in doing that. Did you have a question?
Is there already a predetermined, let's say that the state legislature funded the full $50 million, is there a predetermined formula for how that would be broken up by county?
My understanding is they have a pretty good base on that, but they do want to do some extra work because there's the acknowledgement that more rural counties, in order to just even have that base capacity per capita alone is not going to work. So they may need an extra boost beyond just a per capita funding in order to have a basic level. So that's kind of a general thing they're looking at, whether or not it's going to tweak a little bit beyond the last version I saw, because I know that's still part of some of the other work that they're going to continue to explore.
I think my bigger concern was that it would all go to King County.
Yeah. So, I think that's a part of what they're really trying to address.
Okay.
In kind of a similar question is, what's the base? So this money, this 25, 3, and 2 a year, is that on top of the money they're already spending? I mean, if so, how much are they spending currently on those types of initiatives, if anything?
Torney, did you want to dive in on that one?
This would be dollars at this point in time on top of those dollars, but when we get to the $100 million level, we would subtract out what is currently given. Right now, this is a shortfall. Yeah. And so this is looking to add to those dollars that we're getting through our local government assistance, our LGA dollars at this point in time.
How much, if any, are we getting from the state for any of that?
What we have gotten from our LGA component since 1998 is $2,101,429 per year.
Here, but I'm talking statewide.
Statewide, I don't have that number on the top of my head. Okay. But this would be in addition to those dollars at this point in time because it's not approaching that $100 million need.
And that's why I asked Torney to step in because he knows that number off the top of his head because it's been that same number for years now, which is part of the problem. But I will get you the current statewide spending number. So some of the other work that's going to be happening during this biennium, really refining that formula for distribution to LHJs, looking at long-term funding mechanisms. Is there something that we can put in place that would be sustainable and provide for public health? Determining how the funding will be allocated across all of the core services. As I mentioned, right now we're really focusing on those near-term needs with chronic disease and communicable disease, but how will things split out over time? Really looking at some operational guidelines and standards for performance of those public health services across not only Department of Health but the local health jurisdictions, and then really looking at a accountability framework. We want to be able to show the legislature what they are getting for their money and to be showing that we're all meeting the standards that are being developed. So this whole effort is being branded as Public Health is Essential. You will see some of your materials in front of you that have not only that chart I showed you earlier, but then some further details on what the ask is. Also in your packet last time, there was several pages worth of details for you to go over. So again, this is a major push by Public Health this session. They are still working on some of the communications materials as well as the outreach strategy with the legislature. So that's going to be an ongoing effort as we ramp up. There is a website available if you want to go look there for more details and kind of see what's being developed. Or I'm happy to answer some additional questions, and same with Torney. He's been involved in this for quite some time now. So, any other questions?
Questions for Linda on Foundation of Public Health?
Okay, thank you.
So at this time, please note for the record that Commissioner O'Quinn has joined us for a total of 8 members. And we will move to the action item portion of our agenda. First item on the agenda is the election of a 2017 chair for the Board of Health. I can go through the Board of Health leadership responsibilities and chair and vice chair selection guidelines if anybody would like me to do that at this time, or we can move into a discussion of Board of Health chair.
Mr. Chair, under the circumstances where we're trying to come and develop a health district officer or find one, and with that composition going for us, I would make a high recommendation. I'm losing my voice, so it's like the rest of you. If you'll recall that when we came up with the selection guidelines, it was possible when, while not required, the chair is encouraged to serve 2 consecutive terms, and the vice chair is encouraged to seek the chair position at that time. So I will make a motion that we accept you as a chair for the coming year 2017.
Second.
Moved and seconded. Any discussion on the motion for myself continuing as chair? See, you get 1 more year of freedom. You get one more year.
I know the feeling well.
Yes, I'm sure you do. All those in favor of me continuing as chair?
Aye.
I will abstain. So 7. Any opposed? Seeing none, 7 and 1 abstention.
And Mr. Chair, relating the same manner to next on the agenda, then I would accept the same thing for Commissioner Quinn to continue as Vice President, knowing fully well that the possibility going into chair in the 2018 year.
Oh, and I'm seconding that motion.
Thanks.
So we have a move and a second for Commissioner O'Quinn to continue as Vice Chair. Is there any discussion? Seeing none, all in favor of Commissioner O'Quinn continue as Vice Chair, say aye.
Aye.
Aye. Any opposed? Any abstentions? None. So we've set our Chair and Vice Chair for 2017, and now we will move on to action item C, Resolution 1608, adopting a Board of Health legislative agenda for 2017 for the State of Washington legislative session. Linda Graham.
Hello again. So Kevin, when we at the executive committee, said he was just going to get me a stool so I could just sit up here. But okay, so similar to last year, I have the proposed legislative agenda in a Word document here, so we can go through that. If you want to make any changes, I can make them right here for you to see. And then we can have final vote on the agenda and the resolution for that. A couple of things I do want to mention. If you recall, at your last meeting, there was discussion about trying to do some sort of prioritization or categorization of the legislative agenda items. And so I think Councilmember Beggs was nominated by, I think it was Lori, who said, hey, how about you work on that? So he took a first crack at that. And then we brought that forward to the policy committee to look at, and they were pretty pleased with how we broke things out. So if you'll notice, there's one category which is the highest priority, and that is where the staff and board members will be very active in working on efforts statewide on advocacy and really working with our local legislators to see those things adopted. The second category is priority issues, but they're really being led by other entities in the state, but we will certainly step in and take action at their direction. And then the third category are those things that we will monitor for the legislative activities. We'll keep the board informed, and if there is the need to step in and take some kind of action, we will look at doing that. A couple of things I want to note from the committee discussion. They decided that they did not want to include the vaping device tax issue at this time. This is based on the fact that I'm not hearing any specific proposals out there yet, but it is an issue we can always add in later if we decide to. Same with the sugary beverage tax, and then the rural water exempt well issue. We removed those as well. We also took off the sick and safe leave issue following the statewide initiative passing. And then one other thing I want you to think about, this is a very long agenda, which is fine in a lot of ways, but if you wanted to look at narrowing that down, there are three issues you might want to consider. The one, educational opportunities, and one on homelessness. These are just much more general legislative items than some of your others that get to more specifics. And then also the immunization issue. It's pretty doubtful at this point that there will be any legislation on that this year. So just some things to think about as you look at this. So I'll just open it up to you. Comments, questions. Are you good with it and just want to vote? Go ahead.
Questions, comments?
I have a comment. Thank you for taking the stab at it, and I like how you've divided it into the three categories, and it definitely helps prioritize rather than feeling like we're trying to be everything for everybody. So thank you very much.
I was just going to say, since those other ones that you mentioned at the end are only for monitoring, I would just assume leave them on, but let you prioritize it. If nothing's happening, then you don't have to do anything.
If that's what the committee wants.
Linda, you made a comment when you talked about and I think Shelley brought this at the last meeting regarding Fairchild Air Force Base and the tobacco usage. Did you get an answer on that? Because Linda and I talked about previously today. Would you like to add?
Yeah, I know the question came up last year because it seems to be one of the major arguments that are made against raising the age to purchase tobacco and vaping products has to do with being able to enter the military at age 18. So I did some questioning just sort of military system-wide, and then was also able to get hold of contact out at Fairchild Air Force Base, thanks to Paige from our tobacco program. And the information we've received is soldiers are less combat ready and take longer to heal if they are using tobacco products. There is a 34% smoking rate amongst active duty military. If you look at Spokane general population, it's right about 15%. So it's more than double our local population. And also it's 30% among the younger enlisted personnel in the Air Force, which relates to Fairchild. And they spend about 14% of their pay on cigarettes. Also, the lung cancer mortality rates are double among veterans compared to the general population. So you have that.
Thank you.
Any other questions? Any urge to discuss any particular points on the agenda as presented? Seeing none at this time, I will ask if there is a motion on Resolution 1608.
So moved.
Second.
Moved and seconded. Is there any discussion of Resolution 1608? Seeing none, all in favor of adopting Resolution 1608?
Aye.
Is there any opposed? None. The motion is passed unanimously.
All right, thank you.
So next we will move to Resolution 1609, calling on the Washington State Legislature and senators and representatives. You know what, Linda? You just go.
You don't like the title?
It's a little... I won't read it.
It's all right. Well, actually, at the policy committee, I raised the issue of bringing these forward again. I had mentioned it here as a whole body, talked again to the policy committee. They were very interested in bringing these two separate resolutions forward concerning two of your key legislative agenda items. and that was further approved by the executive committee. But what I'd like to do is ask Brian, who's a member of the policy committee, to present these.
Sure. So on the first one, on raising the minimum age for legal sale of tobacco, what we're asking the board to do is just approve a specific resolution. It's already in our agenda, legislative agenda, but we want to be able to say that we've signed off and said we support this, both to the legislature and outwardly facing everywhere else in the community. We think this would be a very positive step towards community health. So that's essentially what it is. There's a lot of whereases, but essentially raise the age to 21. And, so I would move that we do so for purposes of any further discussion. That would be 1610. Yes.
Oh, flip them.
So comments? Yeah, comments on 16.9?
Oh, sorry.
That's all right. Let's continue with 1610. We've had a conversation now. So.
Okay, so at this time, we're going to flip-flop and we'll go to discussion on 1610 first. So this is...
We need a second.
We have a motion and a second. Any discussion on 1610 at this time? Is there all in favor of adopting 1610? Say aye.
Aye.
Are there any opposed? None. Motion passes unanimously. So now let's flip back to 16.9.
16.9. Sorry about that. I will move that we pass 16.9, and again, with very similar rationale. It's in our legislative agenda. It's the core to what we do, and we just want to send a strong, clear message to the legislature and everyone else that core of public health needs to be adequately funded.
We have a motion on 16.9. Is there a second?
Second.
Moved and seconded. Any discussion on 16.9? Seeing none, all in favor?
Aye.
Aye.
Any opposed? Seeing none, motion passes unanimously.
Great. Thank you all. So these will all be shared with our local representatives and senators, and also I will be sending them to the leadership of the legislature. So thank you.
So now we will move on to item F, which is a guideline and recommendation 1601 to encourage and assist owners and managers of multi-unit housing to protect the health of tenants through smoke-free housing policies.
So in regards to the guidelines and recommendations, both 1601 and 1602, if you recall, Cindy and Paige with our tobacco, vaping, and marijuana prevention program provided you updates at the last meeting. They talked not only updates kind of on their work in general, but they talked about these two guidelines and recommendations they'd be bringing forward, and also the toolkits that they have developed that relate to these. So the idea really with these is to raise the profile of the issue in the community, whether it's amongst business owners or multi-unit housing owners or among tenants, about the issues related to second and third hand smoke, and also raise the profile of these toolkits that they are available to assist businesses and multi-unit housing owners in creating worksite and housing smoke-free policies, and really hoping to push some greater interest in doing these policies. I know Paige mentioned that we've been pretty successful in working with a lot of the multi-unit housing owners and getting some policies in place, but there's a pretty stubborn last percentage that we're really trying to move forward, so hoping that these can make some difference out there. So any questions on those?
This is a recommendation, but it's not, there's no enforcement mechanism tied to this, correct?
Correct.
Simply, we're encouraging and recommending.
Right.
Okay.
Yeah, in the last couple of years, the policy committee, well, actually it was the governance committee, decided to do two different levels of policy work. One is resolutions, which is a much more clear statement, often much more has authority behind it. Guidelines and recommendations are much more, we encourage the community to, address these issues, think about these things, and here's some mechanisms to help you with carrying that forward.
Any other questions for Linda? Mr.
Linda, is there any kind of an educational program set up? Or I maybe I missed missed not reading that, but I didn't see that.
Well, that's a part of what the prevention program provides is they work with different groups, whether it's realtor associations or business owner associations. They're also there to answer phone calls when they get calls and to go out and provide technical assistance. So it goes beyond just the toolkits that are being provided, but we actually have hands-on personnel who not only seek out people to talk to and to try and convince to implement these policies, but also work with different groups and respond to their inquiries. So.
Any other questions? Seeing none, is there a motion on guidance 1601 at this time? We have a motion. Do we have a second?
Second.
Moved and seconded. Any discussion of 1601? Seeing,
Just a little bit, and really it's just kind of to give my perspective on staff. I really appreciate the distinction between a resolution and guidance and best practices and things like that, and I think this is perfect for that category, and so I appreciate that, and I really like that we're giving building owners and employers tools. I think from what I've seen in my short time on the board, your department and the district do a great job of doing that. And I think that's so helpful because people know there's a problem. They don't know what to do. They don't know what the law is. They don't, and including nice graphics and all that. So I think that's great. My only caveat is that sometimes I feel like certain groups, as they fall out of favor, and currently smokers are in that group, can get beat up and bullied and coerced a little bit or feel that way, whether they are, even if it's technically for their own good. So I appreciated when I read the language carefully that there seemed to be some space for that and doing what's appropriate, but in the push to educate, I just hope that we also educate that everyone's important and everyone's a citizen or at least a resident, and they're adults and they make choices, and that should be honored in the spirit. Otherwise, we get more pushback and it's less productive. So with that caveat, I'm strongly in support.
Great. And just to do a follow-up on that, I really appreciate that concern. We've actually had several conversations around those kinds of issues, both for the housing and the worksite policies. And one of the first things that we tell the business owners or the landowners, and it's in the toolkit, is really think about who are your employees and who are your tenants and what is the best thing for them. And certainly if you do want to move forward, make sure you do some early engagement with them, do some surveys, involve them in the process so that it's not something that will disenfranchise folks.
So we have a motion that has been seconded on the floor. We are in discussion. Is there any more discussion? Seeing none, all in favor of guidance and recommendation 1601, say aye.
Aye.
Any opposed? Seeing none, or hearing none, the motion carries unanimously. And now move on to guideline and recommendation 1602.
Move for adoption.
Second.
We have a move and a second. Any discussion?
Yeah.
Okay, Mr. Munch.
Along with what Councilmember Brienne brought up, some of this wording worries me a little bit. It says employers also have the option to implement a policy to not hire people who use these products. That seems like it's a discrimination case waiting to happen. I mean, my understanding with the no smoking law that we have in place is that you can't smoke inside any building. So businesses that allow smoking on site generally have a spot off to the side. It has to be away from the entrance. I just, to me it seems like we're overstepping and pushing too hard for regulating what people do with their lives. I know all about the dangers of smoking and all of that, and I agree that it is an issue, but I'm not in support of this resolution this recommendation the way it's worded right now.
Okay. If I can respond to that in a couple of ways. I appreciate the concern. It's something, again, we've heard before and have been working with folks on. A couple of things is that this does go beyond the smoking in public places requirements. For example, here at the Health District, we now have a completely smoke-free campus rather than just the indoor air issues. So it's going beyond that in cases where that's what an employer would like to do. Also, I'll defer to our attorney, but smokers are not a protected class under discrimination suits.
And Just a follow-up on that. So far, if you look at disabilities or that sort of thing, there's no basis currently for a smoker to bring an action on the basis that they were discriminated against solely because they smoke.
Yeah. And I know, Paige, you've had some discussions with like the fair housing and some of those folks, and they didn't have any concerns. Do you want to have the mic, Mike?
Thank you.
Thanks. Yeah, so with regards to the housing, I mentioned this last month when I presented. We talked to Northwest Fair Housing Alliance about any concerns they have about the resolution you just passed with housing, and they did not, because it doesn't change the amount of housing available. It just mandates some of the policies around where people can smoke. With regards to tobacco-free hiring policies, this is really something that we counsel work sites on if it's right for you, and particularly it's popular among healthcare organizations. Also, Spokane Regional Health District does not hire tobacco users because we are modeling the behaviors that are good for community health. And many of our partners, really healthcare heavy, don't hire tobacco users also. But if we're approached by industry, like specifically trades is really popular, we would work with the employer to figure out what's best for them, but that's a higher tobacco use industry, so we'd probably counsel against that and really push for cessation resources, making sure that your insurance covers all 7 FDA-approved tobacco cessation methods, and having a designated area that employees can use. So it's in there because it is an option, but it really is something that has to be done for the specific organization.
Any other questions? Raina.
I was just going to weigh in, kind of continuing and responding. I agree with our counsel that smokers aren't a protected class, but the concern is, are someone going to be deprived of their livelihood because they're addicted to tobacco and haven't figured out how to not be? And so to me, that's the concern. And so I really appreciated what you said about how you and we as an organization are counseling, making sure there's cessation options as opposed to the just don't hire, which might be cheaper for the employer and easier, but disruptive to everyday people and thus creating other health issues for us down the road. So I just hope that continues to be a high priority in the communication, even though technically, legally, they can. Although I might question whether a government organization can under a different theory, but that's, I'll let our lawyer deal with that. Thanks.
So I guess I'm just building off of that. I'm curious though, because it does specifically call out in here, employers have the option to implement a policy not to hire people who use these products. How much of what you do is promoting that piece versus promoting the smoking cessation piece? I mean, I think I have the same concerns that have been expressed, and that's really the only area of concern I have in this.
So is this on? Yeah, it's on, right? It's on? Okay.
I guess I want to make sure that that's not the number one thing that we're promoting around this work.
Right.
That's a tool.
Mostly, a couple things. When employers call us, which is really infrequent, and that's one of the reasons that we're looking for the board's support on this, is we want to do more promotion about healthy work sites. But mostly when people call us, they're asking, how can I help people quit smoking? And the number one thing we do is talk about cessation resources, and we also talk about bigger policy, like what kinds of insurance do you have for your employees? Like, can they access services if they want to quit smoking? That's a huge one. So we talk about that first and foremost. And then we usually talk about what the worksite is like. So for example, SRHD has grounds. So we would talk about, where are people able to use tobacco or smoke? So our policy here is tobacco, vaping, tobacco, vaping, and smoking. So we talk about what their needs are in that regard and talk about designating an area. We don't really promote one over the other ever because it isn't that tidy when it comes down to working with an employer. And so far, I've only been working on this since last February, and I haven't been approached to implement a policy for non-hiring of tobacco users yet. But there are lots of existing policies in our community.
Further questions or discussions? We have a second in motion on the floor for guidance 1602. So we'll bring that. Seeing none, we'll bring that to a vote. All in favor of adopting guidance and recommendation 1602, please say aye. Aye. Those opposed?
Yeah.
Motion is carried 7-1. Note that Councilmember Munch stands in opposition. For the record, thank you. And now we will move on to item number 9, which is an executive session, labor negotiating guidance. This executive session is held in pursuant to RCW 423144. So, Torney, who will we need?
Sue and myself, 5 minutes.
Sue and herself, 5 minutes. We will. Are we sure we want 5? It's going to be that quick?
It's never that quick.
Let's say 10. So we will
Except for then we can't get out of here. Let's
Okay, 5. All right. Well, okay. I understand. We have to stay 10. Yes, you're right. Okay, so 5 minutes. We will reconvene following the executive session. Thank you. We'll move out of executive session, and our next item is board member check-in.
I just wanted to say that we do have a new commissioner, Commissioner Kearns. We happened to fail to put it on his calendar that he had a health board meeting today. So I guess with that transition over, since it happened Tuesday night, it wasn't his fault that he's not here. So I will state that for the record, because I did call and ask him. I said, "Are you on your way to the health district meeting?" And he said, "What health district meeting?" So his calendar is just getting set up now, and he will be joining us. And so I'm assuming that you'll put him through a board orientation as well. So, and then with that, Merry Christmas and Happy New Year to everyone.
Since we're all plugging, tomorrow is the City of Millwood's tree lighting at Inland Empire Paper. They are out there busily decorating one of their standing trees, and so urge you all to come by at 6 o'clock, and then we will be having events afterwards. So thank you all, and happy holidays to everyone. Mr. Munch.
On the lighting theme, those of you who have to park or pay to park downtown, we use some of our revenues to beautify the downtown, and there's some real beautiful artistic kind of Christmas light balls that are dangling from light standards in the downtown core, and put together with the help of the Arts Commission. So next time you plug your meter, know that you helped fund some beauty downtown. And then secondly, on more serious, but also for the holiday and the winter season, is the City of Spokane has, working with Catholic Charities and some other groups, put together a more robust housing shelter. It's supposed to be 24/7, whether you have a family member with you or a pet, or and it's so that's in process now. We're looking for more partners, because even though we came up with another $500,000 from the city, it's going to cost more than that. So Spokane Valley, if we may come to you and say, hey, shelter them here in Spokane, and you're less likely to find them people who are in a really jam on your own doorsteps, I think. So, but it really is a regional problem, and I think the county has participated some in that.
We did a one-time contribution this year, and then what we're supposed to begin now is the business plan behind it for sustainability. And so we're waiting on that so that we know what the plan is.
Okay. Yeah. So anyway, it's, as anyone in local government knows, a huge lift to start getting into homeless shelter issues. But apparently the state and the feds aren't going to, and in Spokane fashion, kind of practical way we're doing it. So I look forward to more of that. But I just want to highlight that so that we can get that plan and make it sustainable.
Thank you all. So the last item is setting of the next regular board meeting for January 26th of 2017. Please mark that on your calendars. And now we move to adjournment. Motion?
Motion. I make a motion to adjourn.
Second?
Second.
All in favor?
Aye.
We are adjourned. Thank you all.